Today's MS Mental Wellness Chat is on a really important topic. It is on managing mood changes. And this is a really important thing. And so this program would not be possible without MS Views and News. So thank you, MS Views and News, for bringing this to the MS community. And thank you to our sponsors. Janssen, Johnson & Johnson pharmaceutical company, Novartis, EMD Serono, Bristol-Myers, Squibb. Thank you so much for your sponsorship that allows this very important program for everybody. So just going to introduce myself, and we may have some new people on here. If you know me, you kind of know my story already, but if you don't know me, my name is Jessica Thomas. I am a licensed clinical social worker, and I specialize in helping people live well with neurological disease. My passion is helping people in the area of mental wellness, mental health. And the reason why I do this work is because I'm very passionate about it, but it's also because I live with MS. And early on in my own MS journey, I had a lot of anxiety and I needed a lot of support. So that's why I do the work that I do. But to give you a little bit more of my story real quick, 17 years ago, I was married to my husband. And then 16 years ago, I was diagnosed with MS. 15 years ago was when I decided to take my social work degree and focus on helping other people live well with MS. And then 13, soon to be 14, is how old my son is. So that's a little bit of my own MS journey, but we are here today to talk about moods and MS, and I am looking forward to this MS wellness chat. So we'll move on to our next slide. And so before we get started, a couple things that are pretty important here, that this is being video recorded. So if you like to take notes, you can take notes, but you don't have to, because you will have access to see this again in the future. And then what I like to do in the mental wellness chat is I like to use the question box. And I want us to get comfortable with using it because it's a way that we can connect. And so the way this format works is that you can put things into the question box and I can read them. You guys are not able to see one another's input, and I apologize for that. But I'm going to make sure that we are connecting. So if you can go to the question box, and I want you to put where are you from, and I want to do a mood check-in. How are you feeling tonight? And so I will get us started. So I am from North Carolina, and during this call today, you're going to see the sun go down in this room that I'm in because it's going to get dark in a little bit. But and my mood, I'm in a pretty good mood, but I've been very tired today because we have had a lot of humidity where I live. So let me go to the question box real quick. Maddie says hello. He's from Greensboro. Helene is from South Florida. Michael is from California. He's feeling good. Micah is from Kentucky, feeling okay. Monique's from Long Island, and she's in a pretty good mood today. Anne from Los Angeles is feeling blah today. I bet people understand how that feels. Debbie from Florida, Crystal from California, she is a little bit stressed. Stacy from Florida is feeling okay. Jim's having a good day. He's from New Hampshire and says hi. Then we have Mary from California, Rhonda from Alabama. Debbie is feeling okay today. Tammy from Bristol, Tennessee. Helene from Wisconsin. Barbara from New York. Harold from Maryland feeling okay. Maddie's feeling all right. He's walking pretty strong, so he's happy about that. Michael from Baltimore is feeling good. Lori from Florida, the heat wears me down. I get it. And then Susie and Diana say hi as well. So we're going to move on. So we know how to use this question box, and I'm going to use it some in today's program. And I hope that you guys are also are going to make sure that you participate. And I wanted to add in real quick, Biogen is also a sponsor of this program. They are now sponsoring this program as well. So I apologize, we didn't have that down. I did not know that, but thank you, Biogen. Okay, so tonight's chat is about a couple things. We're going to talk about why our moods matter with MS. We're going to talk a little bit about tools to help cope and manage common mood issues with MS. We're going to also talk a little bit about common mood disorders that we see with MS. And then we're going to talk a little bit about how MS symptoms can impact our mood and what we can do about it. And then we're going to end with talking to our healthcare team about our moods. So it's a pretty full chat. I hope that we'll be done in an hour. We will see how this goes, and let's get started. So, why our moods matter with MS? This is a pretty important thing. It's because mood issues are very prevalent within MS. At some point, and most people that live with multiple sclerosis, at some point in the course of their illness, they deal with some sort of mood challenge. Depression is probably the most common, but it's a really big predictor of quality of life to MS, and this is secondary to physical disability. And mood changes can really, and mood disturbances can cause and impact your social, your family, work, a lot of aspects of your life. And emotional diagnoses often occur with other MS symptoms. So if with sleep issues, with cognitive problems, fatigue, and we'll talk a little bit more about that later. And mental health diagnoses are often under-recognized and undertreated in MS, and these are treatable. And so if you take away anything from what I'm talking about today, I want you to know that if you are dealing with a mood challenge, that one, you're not alone, and two, mood symptoms are treatable. So we're going to move on. So why our moods matter with MS? Moods play really a central role in our lives. And this is true for people that have MS and people that don't have MS. And a person's emotional state really influences how you feel cognitively and physically. And our moods overall affect our quality of life overall. So mood disorders in people with MS are really no different from the symptoms that people, the general population has, the people that have mood disorders. And so if I'm seeing and working with a patient with MS that has depression, there's not much difference in the symptoms with depression for the person with MS and a person without MS. And people living with MS and mood disorders, they concurrently, they respond really well to standard treatment. So again, that kind of reinforces that treatment can be very helpful and very beneficial for mood disorders. So we're going to talk a little bit about common mood and affective disorders in MS, and I'm going to give a brief summary of all of these. I'm not going to be able to go in super big depth with each of them, but I'm going to give you an overview so you sort of can understand a little bit. So adjustment disorders. Adjustment disorders are very common in MS, and here's why. An adjustment disorder is usually a issue that happens with someone that is 6 months or less. So they may have mood changes, mood issues. There may be an adjustment disorder with a little bit more stress and anxiety, or an adjustment disorder where someone has more depressive symptoms. But usually adjustment disorders are relatively quick. They happen within 6 months or less. So I do see this in MS, but not often, because sometimes the anxiety or depression can last much longer than 6 months. Now, it's important to know that adjustment disorders are very treatable. Psychotherapy can be very helpful for this condition in general, and mood stabilizers can be helpful as well. Usually people with adjustment disorders have some resolve relatively quickly. And so it might not be uncommon, that you've met someone, or maybe you've experienced an adjustment disorder before where you've had a change. Maybe during COVID, this is a great example. During COVID, many people that I saw in counseling had adjustment disorders, because there was all of a sudden, there wasn't a pandemic, and then we had a pandemic, and then there was social isolation, and the response, the internal response to what was going on externally created an adjustment disorder. So we're going to move on to the next one, which is depression. So depression, is thoughts of, feelings of sadness, irritability, and those are probably the most recognizable characteristics. Someone with depression will experience loss of interest in activities that once brought enjoyment, such as like hobbies or spending time with their friends, or having interactions with others. They also may experience physical symptoms, such as changes of appetite, sleep, energy level, and the ability to concentrate. Depression on its own can cause disability. And people who have depression as well as MS actually can sometimes have poorer functioning and poorer quality of life. And that's why it's so important that we treat depression. Depression is one of the most common, we're going to go back to depression real quick. Depression is one of the most common symptoms with MS, and so more than half of the patients will have a major depressive episode during the course of their illness. And one thing to note about depression is it's actually one of the most effectively treated symptoms. So treatments for depression include SSRIs, which are medications, and then also SNRIs. SSRIs are selective serotonin uptake inhibitors, and then SNRI is serotonin and norepinephrine reuptake inhibitors. Those are a lot of words. And those can be very helpful, medications can be very helpful in treating depression. But I know from the questions I got from this program that people want to know more than just medicines. What can they do? So with depression, there is behavioral modifications, behavioral activation, exercise, lifestyle things that they can do, as well as things such as cognitive behavioral therapy and other therapies that can be very helpful for depression. So we'll talk a little bit more about depression here in a bit. I'm going to look at the question real quick. If you're taking, I have just one question I'm going to answer. If you're taking depression medicine, is it common for those to wean off to see if the depression is still an issue? That is a really good question. So, with depression, and if you had a major depressive episode, sometimes that stabilizes. And so you may work with your doctor and see, if things seem to be stable, and let's try going off of the medication and seeing how I feel and how things are, are helping. If the medication is helping still, or if the things environmentally have changed and I feel a little bit better. So absolutely, that does happen where someone will go off of a medication. But I urge you, if you take a medication for depression, please don't ever just go off of it, because it can be dangerous. Talk to your doctor first and come up with a plan. So we're going to move on to anxiety. Anxiety is another very common comorbidity with MS. And compared to the general population, anxiety is 3 times more common with MS. So people with general anxiety tend to feel worse. They worried often. They're often worried to a greater degree that external events that are bad, and so they tend to almost exacerbate situations. And anxiety can also lead to panic attacks and obsessive compulsive disorder. So those are two other variations of anxiety. Now, anxiety is something as a therapist that I work a lot with, but it's something that I've experienced and that I live with. It's pretty managed on my end, but anxiety is something that can be very real, and I understand this one. And I also can see and know professionally and personally that treatments are effective for anxiety. Treatments that that are done via medication can be cognitive, going back, the SSRI. Often medications that are for depression can actually be helpful for anxiety too. There are also short-term acting anxiety medications, and it's important to talk with your doctor about those. Some of those can be habit forming, and so some doctors prefer a more long-term medication like an SSRI, and they can be very effective for anxiety. Here's some other things, though, that can be helpful for anxiety. Exercise and physical activity can help to support mood. And also cognitive behavioral therapy, and there's a therapy called acceptance and commitment therapy, and that can be very helpful as well. We're going to move on to bipolar disorder. And this one's important to talk about because it doesn't get mentioned a whole lot. We talk a lot about depression, we talk a lot about anxiety, but bipolar is something that can be common with MS too. Not as common, but common. So bipolar disorder is really alternating episodes of depression and mania. So mania refers to a period of like hyperactivity, excessive cheerfulness, or irritability, rapid speech, maybe risky behaviors. You may have extreme changes in energy, activity, sleep, and behavior that goes along with a manic mood. And a person may be having a bipolar disorder if they have a number of manic and depressive symptoms for more than the day, for nearly every day, for at least a couple weeks. Bipolar disorder affects about 13% of people with MS. And so that's compared to a standard 5% of the general population. So you do see that bipolar can be a little bit more common in MS, even though it's not nearly as common as depression or anxiety. Now, one thing to note too is that bipolar disorder is can be very connected also to trauma. Not always, but often, and I think that's important to mention. And then there are treatments for bipolar disorder, and that's important to mention too, because I feel like that often people can feel very devastated when they have a bipolar diagnosis. But treatments that are aimed at managing the symptoms and the mood changes can be very helpful. So you're going to see a combination of psychotherapy and medication. Medication is going to be incredibly important to maintain. And to go back to the question that I answered earlier about depression, whereas when you have depression, you may see if you wean off of the medicine, everything's getting better. With bipolar disorder, it's really, really, really important that you maintain on your medications to help manage those mood switches. And so also psychotherapy, support groups, and psychoeducation about the illness is really essential to treating bipolar disorder. Bipolar disorder often requires kind of a lifelong treatment. What I can say about bipolar disorder, though, is I do work with bipolar disorder quite a bit, and some people do have MS that have bipolar disorder that I work with. And I have seen that as people get older, that symptoms tend to subside, and research says that as well. So whereas you may see a lot of really big shifts in mania and depression, as one ages with bipolar disorder, it tends to subside a little bit and feels a little bit more stable. But the medications are incredibly important to maintain. So the next one we're going to talk about is Pseudobulbar Affect. So Pseudobulbar Affect is also called PBA. It is characterized as like involuntary laughing or crying without consistent feelings. And this affects about 10% of people with MS. And this one occurs as a result of the changes in the brain because of MS, whereas depression or anxiety can be a reaction to the adjustment of the disease, or it can be a psychosocial issue that has kind of sparked that. PBA really is, the etiology of it is from MS, and with depression and anxiety, it can be from MS too. But with PBA, it's very clear that this affective disorder is due to changes in the brain. And so sometimes a PBA episode, can really exaggerate an emotion that a person is feeling, and there's really no connection. So they may laugh and they really didn't want to laugh. They don't think it's funny. This can be a very difficult thing because it can feel very embarrassing for people. And so it is important to know that there are treatments for pseudobulbar affect. And there is a treatment. There's one that's FDA approved called Nudexta. But then also there's SSRIs and other antidepressants that may be used. Now, PBA has not been shown to respond to cognitive behavioral therapy or other talk-based therapy approaches. So if you know someone, or if you've experienced PBA, going to a therapist is not going to be able to help you rectify that problem. You might be able to talk about how it causes frustration, etc., but you're not going to be able to see the same progress as you would by taking a medication. So we're going to move on. So those are the most common mood disorders and mood challenges with MS. I found this slide, and I find that it's pretty fascinating because you can sort of see the connection of MS and emotional disturbance or mood challenges. So if you can think about the how all these circles interconnect. So you see the depressed mood and how that connects with anxiety, tension, irritability, and how that connects with feeling hopeless or worthless or having guilt, and how that might make you feel more tired, or you may experience pain. For some people, they may experience suicidal thoughts. And then also with depression, you're going to see disturbances in cognition, sleep, and your appetite, and a loss of interest and pleasure. So you can see how all these pieces kind of like connect and how they impact each other. So, and you could see with depressed, mood that you may have a loss of interest or pleasure, which makes you feel hopeless or gives you anxiety. So things really interconnect. And I think that's really important to know, is that your mood matters with MS. And if you're having mood challenges, we have to look at that too, as a part of you as a whole person with MS. So I wanted to talk a little bit about the fatigue MS mood connection, but first I'm going to ask you guys a question. Who here experiences fatigue? So you can go to the question box, just write if you experience fatigue. I'll start us off. I experience fatigue. I have quite a bit of fatigue. I took a nap before today's program. So Stacy says yes. Crystal says no, which is great, Crystal. I love when people don't experience it. That's great. Lori says yes. Tammy, Monique, Diana, Rhonda, Helen, Micah says always. Richard says sometimes. Yes, yes, yes. So there's tons of yeses here. And that really correlates with fatigue is about prevalent in 90% of people with MS. And I want you to think about fatigue and how it's interconnected with mood. So if you have more fatigue, and I'm going to ask you this and put it in the question box. If you notice that you have more fatigue, how is your mood? I know when I feel very tired, I feel kind of guilty sometimes that I can't do the things that I want to do, or I feel frustrated. And that is something that can be really challenging. And at the same time, you know, you may have sadness or depression, which impacts the fatigue. So we've got a couple of yeses here, and so you can see that there is a really strong fatigue and MS mood connection, and really MS symptom connection too. But I like to highlight the fatigue because it's 90% of people with MS experience it. And I'm gonna just read a couple. I got a couple more things. Helen says, you know, the fatigue causes her to get sleepy, then she takes a nap, and then she feels guilty for taking the nap. I bet many of you guys can appreciate that. Rhonda says it makes her frustrated. And Maddie says, and it pisses him off, or it makes him mad, and I drink more coffee. And then Susie says, I'm tired and I want to cry. Yeah. And then Pam says it makes her feel more depressed. So you can definitely see that. So we'll move on to our next slide. So have you ever noticed, we're going to go back to that previous one because I'm going to expand off of this just a little bit just for the connection piece. Have you ever noticed a mood and MS symptom connection? So I know we talked about fatigue, but is there another symptom that you have experienced in the past or presently that when you experience it, you experience like a change in your mood? And I will get us started. Cognitive issues. When I have cognitive issues, I feel so frustrated about it. And that can, numbness. So Crystal, when Crystal experiences numbness, she can have mood changes that happen with it, or a response to that, right? Helen gets cranky. And Tammy, you know, just tries to accept it. And Crystal says it feels useless and guilty sometimes with the numbness. And so I'm highlighting this for you guys, for everyone to kind of see that there often can be a really strong connection to MS symptoms that you experience and changes in your mood or how you feel. It's so integrated. Tammy says, yes, cognitive issues make me feel like I'm stupid. And that's so frustrating, right, Tammy? Like that it can make you feel that way. And heat intolerance makes Helen feel discouraged. And Jim says, I go into a shell. And so you can definitely see that you're not alone if you experience MS symptoms and they have a correlation or a connecting mood symptom that kind of goes along with that. So we're going to move on to the next slide. And we're going to talk a little bit about talking to your healthcare team about your moods. Here's the deal. Emotional issues tend to be pretty underreported to the healthcare team. Now, I think that our MS multidisciplinary care teams are much better at addressing mood challenges and issues. But it is your responsibility as a patient to make sure that you are sharing your mood symptoms. And the reason why is because you remember that MS iceberg that you probably have seen at some point or another in your MS journey. You've seen it maybe at an educational program. I have a picture up here. When you go into your doctor's visit, you know, your doctor may see that that you're having challenges with your gait, or that you have some balance issues. Your doctor may see that that you have cognitive challenges. Your doctor is not always going to see that you have mood challenges. Sometimes they might, but often not. That's going to be on the bottom part of the iceberg. And when we think about mood challenges and how they impact our ability to take care of ourselves, how they affect our role performance at home and work, and affects our quality of life and even our interpersonal relationships, moods are important to talk about because they impact the whole picture, and which really does impact your MS. And so I'm going to encourage you, I'm going to ask you guys 2 questions, not for the question box today, but two questions in a bit that I want you to ask yourself before you go into your doctor's office, or ask yourself today. And if you answer yes to them, I want you to call your doctor. But we're going to move on to the next slide. And this is the 2 questions. So during the past 2 weeks, have you often felt down, depressed, or hopeless? And during the past 2 weeks, have you had little interest in or pleasure in doing things? If you answered yes to both of these, it's it's an indication, a sign, not that you have depression necessarily, but it's time to maybe tell your healthcare provider that you're feeling this way. And they will have a series of other questions to ask. These are just kind of a series of like 2 questions. It's from an assessment called the PHQ-2. And then your doctor will probably do a PHQ-9, which is just a little bit more in-depth questions about depressive symptoms. Or they may do a GAD-7, which is an anxiety scale. And it's important to measure these things. Now, I had a situation yesterday, and I think this is really important to share. It's not a patient situation, but a situation nonetheless, that I was talking with someone, and they said, you know, on those questionnaires, I don't tell the truth. And she said, because I'm afraid that I'm going to look crazy, or they're not going to believe me, or they're going to want to change my medicines, etc. And that's a hard place to be, because those questionnaires, why it feels like it might feel very standardized, or it feels like what will they even do with the information, or do they just use it to judge me? The truth is that there's a lot of safety in answering these questions appropriately, because they can get you closer to the help that you might need. And for example, if a person says yes to both of these questions, then their physician may administer the PHQ-9, which indicates that a person's had suicidal ideation, or they're feeling just very low and very sad. From there, often those patients are referred to counseling. And they might be put on a medication, or they may at least start talking about medication, but it's the beginning of getting help and getting treatment for a symptom that's a part of MS that is very treatable. And I had a couple people say yes and yes, and I'm not going to say names out loud today, but I did have a yes and yes, and I'm going to encourage you to tell your doctor to please communicate with them. Let them know that you don't need to hold that in, and that there is probably some aspect of treatment that will be beneficial to you, and that it is not good to be in both of those places for a long time in terms of yes. So mood is treatable. Again, I'm going to be a broken record on this one, guys, because we need to say this and we need to hear it. It's treatable through medication. Sometimes people don't like to take medications, but sometimes medication is the tool enough to allow you to get started to do some of the behavioral activation, to be able to do the cognitive therapy. And so the medication is probably not going to fix it all on its own. I think it kind of takes the combination of all of these things for it to be very successful. And behavioral activation is, you know, exercise and movement. It might be getting enough sleep, learning how to manage stress. It's doing specific things that can help lower the depressive symptoms, and then cognitive therapy as well. And so I think medication sometimes is like the beginning tool that sort of unlocks your ability to access behavioral activation a little bit easier, or to be able to utilize cognitive therapy a little bit better. So that's how I look at treatment anyways. I don't look at one thing usually as enough, but often I will have a patient that comes in and they don't want to do medications. They don't want to take medications. And so we may start with cognitive therapy, and I'll watch them and we'll communicate about medications. And sometimes I'll recommend, I really do think it's time, because we are only getting so far, and without the medication, I don't think you're going to get to where you can see really good improvement with your depression. So we're going to move to the next slide. So I'm going to do a series of a couple of tools for you guys. So I'm going to ask that you kindly participate. Of course, there's no way to know if you're participating or not, but I'm going to ask you to kindly participate. And so before we get started on the tool, I'm going to talk a little bit about the vagus nerve. So this is a relatively new thing for me to learn about this. So I'm kind of teaching you something that I'm learning because this is a new aspect of education for me. And how I've learned about this, the vagus nerve, and its place in depression, mood, anxiety, and bipolar disorder is through a lot of reading about trauma. And so as I've been reading about trauma and trauma's connection to the body and to disease and to neurological disease, et cetera, I was introduced to the vagus nerve. And so I'm going to try to explain this as best as I could, and then we're going to do one activity that we should be able to modify to see if we can help calm the vagus nerve. So the autonomic nervous system, for the most part, has two branches, and it's the sympathetic and the parasympathetic systems. And these are controlled by the vagus nerve. And the vagus nerve has a really prominent role in lowering our blood pressure, our heart rate, and our breathing. And so I'm going to talk a little bit about the sympathetic nervous system and the parasympathetic, and we're going to talk a little bit how learning to calm the vagus nerve, how that can be very important in managing some of our moods. So the sympathetic nervous system is known as the fight or flight part that signals our body and tells us something is wrong. And so this is when our body feels like in more in a heightened state of emergency. People with anxiety often can feel this way. And so if we're in a dangerous activity, or or in a dangerous area, or not area, but like experiencing something that feels dangerous, then we may have that fight or flight, or anxiety, we may have that fight or flight. Now, the parasympathetic system is known as the rest and digest state. And this is the state that's really required for the body to heal, to relax, and to recover in order to regain strength after the stressor has been placed on it. So if you think of like a stressor coming in and activating the sympathetic nervous system, so you're on edge, you feel uncomfortable, you're in that fight or flight, your adrenaline feels higher, your blood pressure is going up, you may even have like a little bit of breathing instability. Then it really is necessary to engage in the parasympathetic system so you can rest, and so you can slow down and can recover from that experience. And so the vagus nerve is majorly involved in this system, and it works in decreasing the alertness, slowing the heart rate, lowering the blood pressure, and helping with calmness and relaxation. And so by that explanation, I think that it is incredibly important to think about its role in our mental health. And there's been a lot of research that has been done on vagus nerve stimulation. It is something that's actually used for bipolar disorder, and it's used for some other autoimmune diseases, but we see it for depression and anxiety as well. And so I'm going to start off by, we're going to do a mood tool. And so this is, we're going to go back to that one slide, the previous one. And so this is calming the vagus nerve. So I'm going to give you I'm going to ask you to do this with me, but I want you to modify this as needed, because we are going to essentially what I'm going to do is I'm going to explain it. But if there's something that doesn't feel right, or if moving your head causes vertigo or dizziness, what we can do is maybe later find a different activity. The point is not to feel uncomfortable or to feel anxious doing this. So for the first thing I want you to do is to, sit up in a seated position, nice and straight. And I want you to move your head to the right, and then I want you to move it to the left, bring it to the center, and then move it one more time, and then move it to the other side. The next thing I want you to do is I want you to put your arms like this and put it behind your head. And the reason why we're doing this is we're stabilizing so we don't turn our neck. And I want you to take your eyes, and I want you to move your eyes and gaze as far as you can to the right. And you do this for 30 seconds until you either feel like you have to yawn, swallow, or sigh. And after you've done this for 30 seconds, I want you to bring your eye gaze back. And I want you to do this for another 30 seconds in the other side. Now, this might be something right now, today, in this moment, is a little bit hard to do. I know for me it's hard because I'm talking. But when this program is over, I would love for you to try this. What happens is that this engages your vagus nerve. And when you do look off, you actually will see that you might feel like you need to yawn. You may need to sigh. I yawn when I've done this exercise. And so when you're done with it, what you do is that you go back to that stretching or that movement and just kind of gauge, did that, how does that feel? And that's kind of reactivating and calming the vagus nerve. So we'll move on to our next slide. Challenging negative thoughts. This is another important mood tool. And so I wrote a list of a couple things that we can do to challenge a couple ways we can challenge a negative thought. So say that you are, that you have a negative thought that you are dealing with. Here are some questions you can ask yourself. And remember, one of two things is, one, I will make sure that you get a copy of this PowerPoint, or you at least get these tools, and I will make sure they get emailed out to you. I'm sorry, I didn't have them in advance, but I will get them to you. So don't feel like you have to write everything down. And then also remember, this gets video recorded. So to challenge a negative thought, ask yourself, what is a more helpful thought? What is another possibility? What would people say, or people that care about me, what would they say? If my friend had the thought, what would I tell them? Am I 100% sure that this is true? If the worst really did happen, what could I do to deal with it, and who could help me? And what is the best possible outcome? The other tool that I like to suggest and recommend with negative thoughts, that is, if you're feeling that you've had very like low negative thoughts or very anxious thoughts, I like to kind of imagine that a separation, because we have our rational brain and we have our emotional brain. And so our emotional brain sometimes is the brain that's telling us negative thoughts or anxious thoughts. And so sometimes it's good for people to name that kind of thinking. So anxious Jessica may have, say something. And if I can identify that that's my emotional mind speaking, that's anxious Jessica's brain speaking, then I can separate and it can help me pull more from my rational mind, my rational thinking. So we're going to move on to our next tool. So this is another tool that can help with anxiety, but it also helps with that vagus nerve. This is another way to calm the vagus nerve. And this is 1 to 2 breathing. And it's a very simple type of breath. You're going to breathe in through your nose and out through your mouth. But the trick here is to breathe out twice as long as you breathe in. So if you breathe in for a count of 4. So let's try this. We're going to breathe in for a count of 4, and we're going to try to breathe out for a count of 8. So sitting up nice and tall, I want you to breathe in for 2, 3, 4. And then I want you to breathe out for 2, 3, 4, 5, 6, 7, 8. If that felt crazy to do, you can also breathe in for 3 and breathe out for 6, or breathe in for 2 and breathe out for 4. But this, to do several of these breaths can be very calming because it calms the vagus nerve, which helps your system relax. And we will move on to our next slide. Our next mood tool, I believe, is visual imagery. And this tool is very helpful. You can find a lot of visual imagery exercises on YouTube. I think that's an easy place. There's a lot of resources. But I like to, for visual imagery, thinking about the control that I have or the control that my patients have to find and identify a safe place, to find a place that they can go to and that they can relax in their mind. I know right now with COVID, we're not traveling a lot. Maybe in the summer we traveled a little bit, but we're kind of getting back to where we're home. And visual imagery is such a cool, neat tool because you can, in your mind, be able to go anywhere that you want to go. And so it's when you're thinking of a place, think of your favorite place. And think about incorporating all the 5 senses. What does that place sound like when you're there? What are the noises that you hear? What are the smells when you're in that location? What about the looks? How do things look? And how do things feel? And so using your 5 senses can very much help. And knowing that you can always, there might be stress around you, or you might be dealing with sadness, or anxiety, but you can take a break from that. You can use a visual imagery tool and take a vacation from some of those moods and just be somewhere differently. I promise you this is very effective, and it's a great strategy to try. I'm going to move on to our next slide. That was a repeat, so we'll go back through that one too. That was, I must have had 2 of them there. So that's the 1 to 2 breathing. So then, and the last tool that I'm going to mention is the exercise and movement. This is a mood tool that is incredibly important. And my guess is if you have been attending, educational programs for a while, you have started to hear a lot about exercise and its impact, its positive impact for MS. And so, while I would love to just focus and hone in only on exercise, I'm going to just focus on kind of movement a little bit. So, so a mood tool can be, and I have a couple of patients that I work with, if their mood is a little bit low, they may get up and do a very intentional, like, walk to the mailbox. A slow, intentional walk, and maybe enjoying or embracing kind of what the weather's like outside. Maybe it's hot, but then when you get back inside, the air conditioning feels amazing. Whatever it is, you can integrate small little bits of movement into your life. And so maybe movement, if you have accessibility needs, maybe movement is using, going, with your walker, or maybe movement sometimes, and this can be a mood tool. Say if you are that you are not able to walk. You can still utilize movement. You can change your setting. So maybe what you would do is, instead of sitting in one room, you change your location. You literally use your adaptive equipment and you move. You allow yourself to see and experience other things. There are really great things that come from exercise. And I want to hone into that, but I think there's also small movements that can really help our mood. And it is very beneficial if you can work some of those into your day. So we're going to go on to our next slide. So I'm going to ask you guys, so I shared a couple of things. What is your number one thing that helps to improve your mood? And I'll get us started. Here lately, music really improves my mood. So I will listen to music. And that I notice that I get a little bit of boost. So if I'm feeling a little bit tired or frustrated or down or whatever, I listen to music. What do you guys do? So Stacy says music and a little bit of sun. Absolutely, the sun is a great mood booster. Anne says light exercising. Karen says exercise, oldies, rock and roll. I love that. Tammy says music and playing games. Micah says crocheting. I have a lot of clients that crochet and get a lot out of doing that. Linda says music, listening to MS podcasts. Maddie says music and talking to friends. Elaine says get a fudgesicle. Yum. Chocolate does help improve your mood. Nora says stay with people and definitely stay in the sun. Jill says tell a good joke. Absolutely, Jill. That's so great. Laughter can very much improve your mood. Helen says change your room or go outside. Diana says I love to read. Rhonda says sunshine. Monique says a brisk walk, and Richard says writing in his journal. So there are a lot of things, so I hope you learn from each other, or were inspired even hearing something that someone does. But it's important to have those things, have a little reminders of little things that you can do that can help improve your mood. So we're going to move on to our next slide. And so here I'm going to pause and respond, and I'll explain this a little bit. So when people registered for this program, they sent in a lot of questions. And so I've been holding on to some of these questions to address them during these programs. So I have two that I wanted to highlight today. So one question was, how can I manage mood swings? This is a really good question, and I think an important one. So thank you for whoever submitted this question. So there's a couple of things, definitely medications might be able to help, but I'm going to teach you some things that you might be able to do that actually help as well. If you look at the connection of mood and things like sleep, making sure your sleep is in check, because if you're not sleeping well, if you're not well rested, it might be a high likelihood that you have more mood swings. Also, exercise. Exercise can change your mood. So it can, you can go from a place of being frustrated to actually feeling a little bit better. Your brain helps to produce dopamine when you're exercising, and that's a feel-good chemical. Your schedule. Having kind of a routine and a schedule sometimes can help moods. And then avoiding caffeine or sugar, or are you eating well? Because sometimes if we are withholding eating, and when I say that, maybe you've missed a meal, you got busy, you forgot, you weren't hungry, that your blood sugar drops, then you might be moody because of that. But sometimes caffeine can make you edgy. And I drink coffee, so I'm not judging if you do. But also increased sugar, you can have a sugar drop, and that can make your moods. So there's, and relaxation. Are you putting in opportunities for relaxation during your day? And that's important. Are you doing stuff to kind of calm down if you're feeling irritable or if you're noticing a mood swing? And then the second question I'm going to read real quick is, are there treatments for mood disorders in MS that are natural alternatives? I take an antidepressant already for chronic pain, but I really don't want to add more prescriptions. And like I've said earlier, you know, medications can be helpful, and I understand definitely if you want to try other things prior to or before, you know, trying a medication. And thinking about behavioral activation, maybe cognitive behavioral therapy, seeing a counselor. But there are definitely things that you can do that can help with mood disorders. And you may see that if you do them, and I have had this happen where people do the behavioral activation, the exercise, they're socializing, they're starting to feel better, and they necessarily don't need to go on medication. But I have some people that they do those things and it's really hard for them to do, and they're not getting quite the benefit of them, so they ultimately do medication and take medication, and then that helps as well. So we're going to move on to our next slide. So tonight's takeaways. Your moods matter. And I hope that you can pay attention to them. And if you notice that, that you have some exacerbated symptoms of sadness or depression, or if you've noticed mood swings, irritability, or periods of anxiety, I hope that you talk with your healthcare team. Mood disorders are common with MS. The reason why I tell you that I have anxiety is because I want to help normalize this. It's a part of my journey. Do I like that I have it? Absolutely not. And while it's managed, I still want to share that I have it because it's a part of my journey with MS. But mood disorders are also very treatable. I've seen people with MS do very well between getting therapy, treating with medications, and behavioral activation. Sometimes all three, sometimes two, sometimes just one. And if you are living with MS and a mood or affective disorder, I just want to remind you that, that you are not alone. So I always like to share what our next mental wellness chat is going to be. So it's going to be next month in September. If you can believe it or not, we're going to be in fall, like very soon. But it's on the 22nd at 7 p.m. And we're going to be talking about breaking the stigma and how counseling for MS can be so helpful. And so I'm going to try to do something a little bit different. I'm kind of trying to think about outside the box. I'm hoping that I might be able to bring a patient that maybe I worked with a long, long time ago to kind of talk with you guys a little bit about how counseling has helped. And kind of, I will be able to talk about kind of what counseling session is like, and we can also talk about some of the different therapy approaches that we're using. So I'll probably hone in on cognitive behavioral therapy, and then also acceptance and commitment therapy, and some other strategies. So so I hope that you will join us for our next MS mental wellness chat. And again, I want to thank all of our sponsors, and so please. I would, acknowledge the thank you to MS Views and News, but then also our sponsors for tonight's program, because again, without them, this program would not be available. And so again, I would like to thank EMD Serono, Janssen, a Johnson & Johnson pharmaceutical company, Biogen, EMD Serono, and Bristol-Myers Squibb. So I would like to thank every company that sponsored this program tonight, because it's incredibly important. So again, immediately following today's program, there's going to be a survey that pops up. Please complete the survey, because guess what? You get to give your feedback, and I grow from it, and MS Views and News is very interested in it as well. And it's been really cool to see how these programs and this chat series has been helpful for you. So please make sure when I go away that you stay on to complete your survey. And if you've been on any of these chats, you'll know that I'll say, I don't really say goodbye to people. I'll say, let's put a bookmark here, or I'll I'll see you again later. So I hope I can see you again next month, and I appreciate your participation. I can promise you that you help one another by speaking and connecting, and I wish you a beautiful evening. I'll see you in September. Bye.